welcome to one more session of our YouTube live and Instagram live. We are live now both on Insta and YouTube, so you can join in as per your convenience. Before everybody joins, let me tell you and wish you a very happy Doctors' Day. And we are proud that we are doctors and we help the suffering community. And we are also proud that we are homeopaths, so that whenever a patient comes with a chronic case or acute case, we're able to treat him or heal him without pain. That is more important, aphorism number 2. Now to start with the session, and lots of people have joined in, Dr. Palak, Dr. Kamla, Dr. Yeah. Now I'll discuss the case. Before a case, let the doctor come in so that we can start the discussion of the case. Before that, I'll just tell you one of the main symptom of a case. The patient came to me with severe headache. With headache, he had a problem of lot of cramps in the muscles, weakness in the muscles. Of course, remedies were given. He was better, but not totally cured. And as we tried to take out the symptoms, he had a very, very interesting symptom. He said, कभी कभी डॉक्टर साहब मेरे को ऐसी जबान में नम सामान लगता है, ऐसी मोटा मोटा लगता है, नम सामान लगता है, चींटी आती जबान में. So whenever this symptom comes to your notice, remember this, the patient is telling you symptoms of numbness and especially of the tongue. Welcome Dr. Babal, Dr. Madan, Dr. Nadia. After using UABNM, you can use mother tincture at least for a month, no problem. Welcome Dr. Sharma, Dr. Singh, Dr. Aki, Dr. Welcome. So let us go further, and happy Doctor's Day to you all. Once again, let us start. So the patient complained about that severe headache with pain in the muscles and numbness of the tongue. Which remedy comes to your mind? Anybody? This is basically, how to, happy Doctor's Day, Dr. Berito. Dr. Almagir, welcome. Dr. Belwalkar, welcome. Let us start the case. Headache, pain in the muscles, and numbness of the tongue. We prescribed 1 or 2 remedies, did not work. Then we prescribed the remedy gelsemium. A very, very interesting remedy. Always confirm or try to confirm gelsemium with the symptom numbness of the tongue. A very, very important symptom. Again, to differentiate from that, if the patient says कि मुझे सिर्फ आधी टंग के अंदर नम लगता है, बाकी टंग नहीं लगता है, मतलब the patient says only my half side of the tongue is numb, rest it's okay. So numbness one-sided is also gelsemium, but more important than gelsemium is natrum mur. So this is how you differentiate, and gradually you come to a prescription. For example, if a patient of urticaria comes to you, and there's a lot of confusion what to give. Bovista is coming, Artica is coming, Epismel is coming. To confirm Bovista, many of times I have seen in case of Bovista, there is numbness of the tongue posteriorly. So whenever there is numbness of the tongue posteriorly, think of Bovista. And of course, if the patient complains of numbness of the tip of the tongue, complains of numbness of tip of the tongue, there are few remedies, very, very important. Confirm that drug with either phosphorus, lachesis, ignitia. Of course, there are other drugs also, but these 3 remedies I have found very useful when there is numbness at the tip of the tongue. So my dear friends, important thing is, whenever after repertorization, there are 4 or 5 remedies on the repertory chart. And then we try to look for the symptoms in the mater medica. Rather than that, look for the symptoms in the mater medica and try to confirm those symptoms from the patient. So you'll be a better prescriber and your prescription will be a similimum that cures the case. This was just a case which I wanted to discuss. And of course, when you're treating case of headache, and sometimes it is very difficult to differentiate natrum mur, because throbbing pain, aggravation in the sun is natrum mur, is belladonna, it's gelsemium. But how to differentiate natrum mur? Anybody? If you want to prescribe natrum mur, I have seen in many cases the patient complains about numbness of the tongue before headache. So whenever, if there is a case where there is numbness of the tongue before headache, do think about natrum. And of course, numbness half part of the tongue, that is also natrum. So this is how gelsemium was given. Of course, numbness of the tongue, you can think about gelsemium, you can think about Nux moscata, you can think about natrum, hyoscyamus, fluoric acid, arsenic, calcareous, lots many remedy. But 3-4 remedies, gelsemium, Nux moscata, natrum, I found it very useful. Can we treat spinal canal stenosis? Dr. Punky. Last week, I had a very, very severe case of severe spinal canal stenosis. He was a doctor, a dentist by profession, had taken a lot of painkillers, no change. He came to me, he said that when he sleeps, he cannot even turn with the side. He has taken all the medicines, cannot go to the clinic. He came to my clinic and he said, when I'm sitting, it's okay. But when I'm lying down, it is aggravated. He was in so much pain, he could not sit, he could not sleep lying down, just sitting used to sleep. One dose of the remedy, he came after one day and said, I am 90% better. So this is the example of spinal canal stenosis, which we can treat depending your symptom similarity has to be very good. That was a doctor by profession himself, and the doctor said the pain is so much, if it does not go down, we have to go for an operation. One dose of a remedy cured the case. Anybody, can you guess the remedy? Anybody? Just one dose of the medicine. And next day he came, he was much, much better. He was 80 to 90% better. This is, I'm telling you because it is very important to understand what symptom we are taking for a prescription. That is very important, you know. Anybody, can you guess the remedy? Very important remedy, interest. Yeah, which remedy? That's what I'm telling you. This colosyntheno. Then if you are prescribing, basically you have to be very, very sure of the remedy and the modalities. This was the classical modality of the patient, you know, that he could not lie down. And the pain was so much that he could not change the sides also. And the pain was like, he was feeling as if there was lightning raining down. And that was the remedy. Aggravation was lying on back. And I've seen in that remedy, in most of the cases, aggravation lying on back, lightning like pain, I have better temporary by pressure. One remedy that should come to your mind is plumbum metallicum. I gave that patient, that doctor, plumbum metallicum 200. 2 doses I gave him. I gave him take 1 dose in the night and 1 in the morning. He said I took the dose in the night. I got up very later in the morning. So I directly came to a clinic. This is how the patient's symptom was relieved in 24 hours. So plumbum metallicum was given. Of course, so spinal canal stenosis can easily be treated. Make sure your symptom similarity has to be very good. Don't always keep prescribing what you call colosynth or phytolica, phosphorus, guaiacum. These are all routine medicines, you know. Try to take symptoms and then you'll be able to be a better prescriber. Okay. So as we go further, yes. Now, if you want to differentiate, see, there are a lot of other remedies which are basically indicated. But if you take an example of phosphorus, as I told you, know, sometimes phosphorus is abused. Yeah, spinal, Dr. Babal, spinal. Now, if you want to take a case of phosphorus also has some peculiar symptom. Of course, a symptom similarity. Now, taking a case is very, very important homeopathy. But then if you understand some symptom related to that local area, that will also guide you to a remedy. In phosphorus, there are some symptoms which are very, very important. And the first symptom that you should remember in phosphorus is burning. Burning in the whole back, and the pain, and the patient feels as if somebody is broken his spine like this. When you break a stick, you know, he feels that way. That is the indication of phosphorus if you want to give phosphorus. In phosphorus, remember one thing, the patient has a chronic complaint of weak spine. He always keeps telling us, my spine is very weak, I cannot sit for long, I cannot sleep for long, I get tired easily, the whole spine becomes weak very easily, that is the indication of phosphorus. One more thing of phosphorus you need to remember, the patient complains of heat between the shoulder blades. Whenever there is heat between the shoulder blades, you must think about phosphorus. Okay, and lobelia again is a very what you call rarely prescribed remedy. But if you want to prescribe lobelia, as I can recall in my Mater Medica, lobelia has one symptoms very important. A lobelia patient sits leaning forwards. So whenever you get a case of spine problem and the patient is better by leaning forwards, think about lobelia. In lobelia, the pain in the sacrum is very much, just by slightest touch, the pain is aggravated, then that is lobelia inflata. Of course, there may be other symptoms also, but I can remember these symptoms that I'm telling you. Yeah, touch of clothing also aggravates. Very nice, Dr. Way. That's what I'm telling you, that was lobelia, but most of the time lobelia we have used basically in asthma. So touch aggravations, as doctor said, that even clothes contact aggravates is lobelia inflata, a very important remedy. So think about that. Sometimes cramps or dragging type of pain. Now see, cramping pain, remember one thing in your practice, you will get a lot of cases when there is cramping pain. Now always don't jump to remedies, like we think about MacFos or cramp remedies. Think what is the cause of the cramp first. It is because of some nutritional loss. That is also important to understand. If there is nutrition loss, just by giving a nutrition, give electrol, you can always cure the case. But in general, if the patient complains about cramps, especially cramps, maybe in the extremities and all, most of the time, think of 5-6 remedy which are very important. First, Cuprum metallicum. Second, Calcarea carb. Third is Stretchinum phos. Fourth is Minianthus, and the fifth is sickle core. Very important remedies. Dr. Komal, Dr. Razek, sparkling Samir, varicose veins, sparkling. Yeah, if you are given a case of varicose vein, I would not say it is very easy to treat, but there are very important thing in varicose vein that make the patient, tell the patient that he has to stretch the legs and sit. Do not keep the limbs hanging. Wear a crepe bandage and then prescribe the remedies. Of course, we have done varicose vein in a previous YouTube and Insta live. If you go and see, there are remedies. Heparsulf is there. Hemimolis is there. Crotalis is there. Lacasis is there. Carbonimus is there. Depending on the color of the vein, it is reddish in color, bluish in color, like a whipcord. There are a lot of other things, but mainly I have seen in cases that occupational therapy, like not letting the limbs hang down for a long time, buying a stocking, wearing a crepe bandage would definitely help in this type of cases. And of course, constitutional treatment. Male child, 4 years, holiday by ship, stopped midway for many hours, started pain in ears, crying eardrops by ship doctors, better, back to home, ear pain, shouting in pain, paracetamol by mother, clinging to mother, capricious and active child. Okay. So whenever the patient, whenever the patient complains about pain, and now, you have a classical symptom that the patient has gone on the ship, and that's why there is a pain. So you can take 2 or 3 symptoms which are very important, where ear pain is aggravated in cold air. One, that would be there in that ship, or second, ear pain aggravated by draft. I would be more happy to tell you that ear pain which are more aggravated by draft are very important, because the sudden flow of wind causes that eustachian tube to get numb or blocked. So you must think 3 remedies very important. The first is Dulcamara, second is Heparsulf, and the third is Lycopodium. That could cure the case. If the patient complained that in the ship, he was just in the ship and cold air was there, and breeze was going on, and the weather was very nice, and because of that he has a problem, then you can simple give remedies like you can give Lycopodium, Heparsulf, arsenic, add chamomilla. Simple. If the patient just wants to tell that there was pain in the ear without any modalities, then you can think about phosphorus, Muxol, Lycopodium, Heparsulf and Lacasis. Now, if you say the child was clinging, now if you see clinging childrens want somebody, they are terrified. So if you add all these symptoms, one or two or three remedies are very very close. First is lycopodium, second is phosphorus, third is kalicar, and fourth is gelsemium. In your case, two remedies I I feel that it should work. The first is phosphorus, second is lycopodium. Sir, what should we approach for treating gout and small joint pain? Now see, gout and small joint pains are very very different. Now if you go symptomatic with mater like small joint pains, we have actia spicata. For gout we have colchicum. You do one thing. Sometimes when you're starting your practice, and you take the whole case, sometimes you don't prescribe the right similimum, and the patient is not better by pain, he is not happy, does not come to you. In this case, you can give a single dose of that acute indicated remedy, active spicatro, colchicum, benzoic acid, colophylum semicifuga, and then take the whole history and try to cure the case. This should be your approach in case if you are new in practice. And of course, if you are very sure you have got a very good case, then go for consultative treatment. Sir, if patient is sensitive to cold and hot weather, what remedies can be taken? No, see, if the patient is sensitive to hot and cold, that means he's ampithermal. So go with that remedies. Or if sometimes if you feel that you are not happy, so you can take a patient is susceptible to extremes of temperature. Then enter the case. Okay. Dr. Malik, welcome. Dr. Desai, delayed speech in children. Yeah, if there is a delayed speech in children's, you can say milestones. There is a rubric milestone, and you can go to that rubric, and you have a lot of remedies. First of all, make sure that why the patient has a delayed speaking or walking and all. Yeah, now go in the fetal life of the patient and ask the mother the history of mother. And if the mother history has something that is not that the mother did not like, or there was we say abuse, we say dominance, we say aloneness, we say anything which basically has caused a problem in the mother, and that passes to the fetus. And that's how basically you try to analyze the case and prescribe the remedies. If you only go by this difficulty in walking, speaking, there are remedies, but I have found if you go by consultative treatment and what happened during pregnancy, that is more important rather than prescribing on for that natrium uro, calcarephos or ferrum phos or phosphorus or macphos in those conditions. Okay. Okay, keep writing questions because sometimes it gets scrolled up. Anything else? So if you go further, I don't know if yeah, just one question. Patient sensitive to coral, when she heard any coral at home, she used to get gastric complaints like urge for stools continued, and she is known case of gastritis, lower abdominal pain, left side of an arm. See, one thing you remember, doctor's name is Dr. Razia. This is basically called as nervous diarrhea, but there is a very good connection of mind and gut. Wherever you are treating a case of irritable bowel syndrome, nervous diarrhea, or ulcerative colitis, most of the time you'll see this type of symptom that something happened, something nervous happened, and the patient has to go for stools. And of course, we have the remedies gelsemium and argentum nitricum. But what is the cause of nervousness? What is the cause of irritability? That has to be first taken care of. Because if you go to the root cause and take the case and prescribe the remedy, most chances are you'll cure the case. Sorry. If you give remedies just for nervous diarrhea, gelsemium, argentum nitricum, till the patient takes medicine, he would be better. Then again back to square one. In this case, you can say you can go to the repertory and see there are a lot of remedies where you get this type of complaints. You might be taking argentum nitricum, gelsemium, but you can always take anxiety or anticipation or nervousness from excitement, kali carb, phosphorus, calcare carb. Very, very important remedies. So look for these remedies and you'll be able to crack the case. Dazzling Medico. Okay, welcome. So one question is that tinnitus. tinnitus with vestibular neuritis. Let me tell you that tinnitus again, if the case comes to me also, I would say little bit difficult because it's a very irritating symptom to the patient. Okay, and the patient is, the patient always comes and tells us that whenever he's working, the noise is less, but whenever he's sitting, going afternoon at his home or lying in the bed, and the voice starts. Sometimes what happens, the patient basically actually wants to hear okay, whether I'm hearing the noise, whether I'm hearing the noise, and he starts hearing the noise. It is like that. So in this case, it is very important to understand that what I have seen in the practice, there is something irritating news which the patient did not want to hear, and he heard from somebody which he did not expect him to tell him, and that is causing a great pain, especially in the ears, and that causes the noise. That's the whole cause of the philosophy of tinnitus, which I have understood in practice. There are 4 or 5 remedies which are very, very important in tinnitus that you have to remember. First is causticum, second is sulfur, third is pulsatilla, and fourth is lycopodium. I had a very interesting case where the patient was relieved with kali iode. Wasim, welcome. And join David Jim. Peripheral vascular disease with leg ulcers but suppressed by medicines, blackish skin with lot of itching. How to go with the case? See, whenever the case comes to us, maybe 20 years back when we were practicing, most of the case used to come after taking allopathy medicines only. So when they are taking a lot of medicine, they have applied a lot of what you call bandage and steroids and creams, antifungal, antibacterial, and then antibiotic. Then they came to us and the area becomes black. Don't always start with Nux vomica. I have seen it does not work. What is the symptom today, present symptom? It is very important. Blackish discoloration, lot of local applications and all. Do think about 3-4 remedies which are very, very important. Think about graphitis, think about anthraxinum, think about hiparsulf, and think about any snake lachesis. These are the remedies which I have found useful in prima facie when you see the case, and then I go and ask the case taking and the history, so that the disease symptom and the drug symptom basically are taken care of, and then we can get good results. Pain in testes, type of dragging or cramping pain. See, whenever you get pain in testes, remember, of course, if the patient is able to describe the pain like dragging and all, it's very nice. But most of the time, patient come just and tell them, "मुझको दर्द है, दर्द है, दर्द है." ऐसी पूरा भरा हुआ लगता है. So there is a lot of congestion in the testes. Think about hemorrhages and think about lycopus. If the patient complains about what you call pain and there is severe pain, inflammatory pain, think about arnica, think about rhododendron, think about rustox, and think about spongia. And generally pain, the patient complains about pain in the testes, general pain, dull pain, dragging pain and all, and you're not able to differentiate the pain, then 3 remedies very, very useful. Hemorrhages, Berberis vulgaris, and pulsatilla. These are very, very important, and try to differentiate left-sided we have Staphylococcus aureus, pulsatilla, lycopus. Right side we have argentum nitricum, causticum, rhododendron, right side. So try to differentiate. These are the remedy charts. Fatima joined. In peripheral vascular disease, are you happy with the answer, or I should go with something else also? I can always give you some other answer also, but you have to tell me that did you get something or some clue of what you want to prescribe? Dr. Johnny. See, whenever you have ulcerations, then it is very important to understand the type of ulcers, how is the ulcer, blackish discoloration, discharge and all. So it's a deep topic. If you still are not happy, I can answer you something else also. Hina Kulkarni, welcome. So just to give you something, of idea about Dr. John. Ulcers, if you see lot of allopathy medicine, they are bleeding very easily. Nitric acid, phosphorus, Moxol. Ulcers, blackish in color, arsenic, lachesis, pulsatilla. Ulcers, they bleed on touch. Hiparsulf, lachesis, hydrastis, nitric acid. And the ulcers are very bad, discharge is very offensive, putrid, lots of pus formation, blackish discoloration, appearing gangrenous, arsenic, sulfur, lycopodium, hippursulf, and aurum sulf. And then just you want to see the color and prescribe. Blackish color, as I told you, anthraxinum, arsenic, sickle core, lachesis. You know, and most of the complaints we have blackish and reddish. Reddish we have arsenic, hippursulf, pulsatilla, and sulfur. So these are basically, and sometimes some ulcers come to us with crust formation. There is a crust formation. So in crust formation, think about conium, rustox, miserinum, and muxo. So these are different type of ulcerations, colors, and all. Then we can basically prescribe. Patient 35 years age to holidays, seaside, remained stressed. Even fish on seaside started aptheid, deep on tongue, painful, very nervous, and easily irritated. Of course, you can basically go in the Matermedic and have lots of remedies, with seaside. But whatever experience of treating cases which I have in these type of complaints, of course, in Nagpur, if you see, there are less seashore, so we get few cases. But in Bombay, I get cases. So when the patients comes and say that seashore are aggravates, there are 3-4 remedies you have to keep in mind. Sepia, arsenic, tuberculinum, magnesium mure, and carcinosin. Seashore air aggravates. But exactly opposite, medorinum, and tuberculum is also opposite. Sometimes carcinosin is also opposite. So there is a very thin hairline difference in these type of remedies, but both remedies are very, very useful. So you can think of these type of remedies. Allergic rhinitis with continued sneezing 10 to 20 times. I think this we have done a lot of times, Dr. Musab. Think about Sabadilla, think about arsenic, think about Orindo, and think about Justicia adatoda. Now, the Dr. Madan says the patient is very nervous and irritable. Now, if you add that also, the remedy which I have told you before would add. Now, classical seashore aggravation. No, I have given you remedies which sometimes covers both. Now, if you want to know that seashore aggravates and it is only aggravation, that remedy should not ameliorate. Then you have to think about arsenic, magnesium mure, very, very important remedy, iodum and kali iode, and natrum sulf, where seashore aggravates. Of course, you can add rustox also, where seashore aggravates, only seashore aggravates. Okay, I hope Dr. Madan, that is fine. Dr. Fareen, welcome. You are coming after, we have been just finishing our YouTube and Insta live. So it is already, now still I can take some few questions. If you can ask, please answer fast. I hope Dr. John, you understood something about the ulcerations. Should we give any mother tincture locally as antiseptic in PVD? I have not used mother tincture in PVD, so I can't comment on that. But whatever I have told you, Dr. Johnny, about the ulceration, the color, the base, the pain, the bleeding on touch is more than sufficient in treating your case. If you see those rubrics and try to repetize, there are 3-4 remedies which will come every time in the repertory chart. Just go to that remedy, 2 or 3 remedies, open the pace of ulcerations or skin, see, and just match with the patient, and you will be able to get good results. So that's what my experience is. At the most, you can take that remedy in LM potency and repeat, so that you can repeat in LM potency. Yes, anything else? I can take few more questions if there are some questions on Instagram scroll up or on YouTube live. I hope you're enjoying the question answer session. I enjoy it very much because it is a revision for me. So I think that's all for today. So no question. That means today the motto of answering all questions. Thank you. Yeah. So thank you very much, everybody. Thank you once again for joining, and I enjoyed a lot. As I hope you also enjoyed as much as I enjoyed teaching you Once again, before I go, happy Doctor's Day to everybody. Make sure that you treat the patients diligently and keep getting results. And if you get results, do share your results on the Insta and YouTube Live so that we all can learn. Thank you and bye for now.